Hi, I'm Rich Kutchman with Strategic Self-Reliance and Defense, and today's video is the continuing series on the secondary assessment. So just to recap, the secondary assessment is what we call the focused assessment. It is intended to pick up any additional injuries after you've addressed the primary assessment or the initial. And the initial assessment, the primary assessment, is meant to identify life-threatening injuries and then treat those. So you move into the secondary assessment after the primary. And remember, the secondary assessment includes the chief complaint, the sample history, the physical exam or the physical assessment, and then you have the vital signs. And today's topic is the vital signs. So when we talk about vital signs, they're vital because you need them to live, right? You need a pulse rate or a heart rate. It means your heart is beating. That's vital for life. Respiratory rate, you got to breathe, okay? Blood pressure is a standard vital sign. Now, for this course, the wilderness medicine courses, wilderness first aid courses, they don't use blood pressure because blood pressure, learning to take somebody's blood pressure is a skill that requires a bit of finesse. You need to practice it. But we have an alternative to it that we teach, but I'm going to talk about both a little bit here. All right, so let's cover vital signs. Let's talk about vital signs. So, why do we do vital signs? They don't tell you whether or not there's something. They don't tell you what's wrong with the patient necessarily. Okay, but they're an indicator of patient's condition. Are they really bad, or are they just or are things okay and they're just maybe their blood pressure's a little high, or their respiratory rate's a little high, their heart rate's a little low, whatever the case may be. Okay, so it doesn't tell you what's wrong normally, but it's an indicator of if the patient's stable or unstable. All right. Um, and a big piece of vital signs, while one data point is important, um, more importantly are trends. What are the vital signs doing over time? Okay, is the heart rate changing? Is the heart rate getting faster or slower? Right. Trends are more important than one data point. Um, all right, so we take the vital signs because that's valuable information for us to make decisions on stability of the patient, how quickly we need to move as far as evacuation. Not so much for treatment because there's not a lot of treatment typically we're going to be doing out in a first responder scenario beyond the primary assessment stuff. But um, all right, so really it's mostly to give that data. How fast do we need to move to evacuate? Give that data to the next caregiver in line, the EMS personnel, the ER staff. Um, all right, so what is included in vital signs, right? Typically, it's heart rate, respiratory rate, something along the lines of blood pressure. Okay, we're going to call it skin signs, but they kind of, and I'll talk about um, how they relate to one another. And if you go to the hospital, your doctor's office, you're going to get a pulse oximetry as well, oxygen saturation. Right now, I'm going to preface it by saying level of responsiveness or level of consciousness, alert or oriented. What is the mental status? Are they altered? Do they have an altered status? AMS. That's a important point too. Now you've already figured out mental status, their LOR, when you did their primary, right? Primary assessment, it's part of it. So you should have done that already. But if we're going to talk about it again here, just as a recap, LOR, level of responsiveness, or LOC, level of consciousness, um, or are they alert and oriented, right? Those are all related assessments. You're trying basically just to figure out, is the brain working the way it's supposed to? Is it functioning? It might not function for lots of reasons. Lack of oxygen, lack of glucose, lack of blood going to the brain to carry that oxygen and nutrients. Different reasons. Contusion and swelling. There's lots of potential injuries and illnesses that can cause altered mental status. All right. The way we typically teach a down and dirty assessment for altered mental status, or for level of responsiveness in the EMS field, is AVPU, mnemonic or acronym. alert, verbal, painful, or unresponsive. So do they respond normally like you and I do normally? That's alert. If they only respond to a verbal stimuli, then it's V. If they only respond to a painful or noxious stimuli, P. And if they're completely unresponsive, it's U. The further down they go, the worse the scenario. Okay. All right, so that's LOR first. Then we got heart rate, or what we call the pulse, right? And the easiest way is just checking on the thumb side, the radial pulse. Right? If you're going to check somebody's pulse, use these two fingers, light pressure in that little groove just under the thumb. Look at your watch, count the pulse, how many times you feel it beep, 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 bump, bump, bump there, over 15 seconds. Okay, whatever that number you get, let's say you get 20, multiply that by 4 because there's 15 seconds times 4 gives you the full minute. So their pulse or their heart rate is now going to be what? 4 times 20 is 80. So their heart rate is 80. So jot that down, right? Again, you write it down so you remember it. And know that an adult, normal, what we call normal heart rate for an adult is 60 to 100. So 80 would fall right in the middle of normal. Okay? All right, so that is heart rate. Respiratory rate. Breathing. How fast are they breathing? All right, what is the respiratory rate? Easiest way to gauge that is to watch their chest, or actually sometimes put a hand on the shoulder, or a hand on their chest, a hand on their back. And again, watching, using your watch in the second hand, count the number of breaths over the full minute. Now, sometimes I'll do 30 seconds and just double it, but more accurately is to do it for 1 full minute. 1, 2, right? So you get that count over 60 seconds. Normal for an adult is 12 to 20. Try, if you can, it's always best to not let them know, try to do it discreetly so they don't know you're counting their breathing, because people act weird when they see that you're counting their breathing. They slow down their breathing, they hold their breath. It's just weird. So LOR, heart rate, respiratory rate. We would, when you go to the doctor's office, they're going to do your blood pressure. Okay. We're going to talk about skin signs, which is an alternative, more rudimentary way of determining blood pressure. When we're talking about blood pressure, what we're talking about is what is the pressure that the blood is causing inside of the blood vessels, right? Heart pumps it, it's a pump, it creates pressure. We gauge that pressure, and we know that we have to have a certain pressure to get the blood everywhere it needs to go, right? We call that perfusion. When the blood gets to the tissues, that's perfusion. If you don't perfuse an organ like the brain, it doesn't function right. You get goofy, right? You could be anything from a little confused to unconscious. Right? Doesn't perfuse the kidneys. You don't make urine. You don't filter blood to make urine. Okay, so you have to have perfusion. Blood pressure is an indicator of that. For this wilderness medicine courses, we teach skin signs. Okay, again, another acronym. TC, TM, tissue color, temperature, moisture. Okay, that's a rudimentary or rough gauge of blood pressure. Right, tissue. We're looking at somebody's skin, tongue, inside the gums. You're looking at the gums, the mucous membranes inside the mouth. For color, tissue color. Right. So, and it's normal for race. So, if you're, fairly tan or darker complected white person, you shouldn't be super pale. Right now, some people are just pale. Right. But their mucous membranes, now that's the skin. But if you look at somebody's mucous membrane, everybody's mucous membranes are the same color. They're pink, right? If you look at their gums or their inside of their cheek and it's pale, like pale, pale pink, almost white or gray, ashen, as we say, that's abnormal, right? So tissue color. Temperature, the back of your hand, kind of like you're checking your kid for a fever. And you feel the skin. Is it warm? Is it cool? Is it cold? Right? It should be warm. Okay? And then lastly, moisture. Right? Again, are they sweating? Now again, if they just came out of the pool, they're going to be wet. If they collapse running a marathon, they're probably sweaty. Take those things into consideration. But if they're just sitting on the sofa, complaining of chest pain, and they're pale, they're cool to the touch, and they're starting to sweat, those are bad signs, right? Diaphoresis. You shouldn't be sweating at rest, right? So tissue color, temperature, moisture. Those are kind of indicators of blood pressure. And the reason we say that is because blood circulating is what, blood in your tissue is what makes you not pale. When you don't have blood circulating in your tissue, you're pale. The gums are easy to see that. Temperature. The blood is what warms your skin. Okay, and then the moisture is just a response. Okay, all right. So I said I'd talk a little bit about SpO2 or pulse oximetry. They put the little probe on your finger. They get a number. It's a percentage. We're not going to be doing that in the field typically unless you are trained and have the equipment. There's no way of gauging that necessarily. So, but I will mention it just so you understand the process here. So our blood has red blood cells in it. Red blood cells bind oxygen. That little device shoots a light, which measures how much oxygen, how much of the red blood cells as a percentage are bound with oxygen, oxyhemoglobin. So normal is above 92%. And really most of us every day are 97, and above, 97% and above. But 92 is the threshold of what we call normal. If you're below 92%, there's likely a problem. Okay. So that's oxygen, pulse oximetry or oxygen saturation. We hear it called SaO2 or SpO2. That's what you'll see that they're doing it in dentist's office, doctor's visits. You go into the ER, the urgent care, they're going to take that. That's an indicator of just, are your lungs doing their job? Is there enough oxygen in your bloodstream, right? And if there's not enough oxygen in your bloodstream, it's either the environment doesn't have enough oxygen in it, you're at high altitude, your lungs aren't working the way they're supposed to take that oxygen from the air and get it into your bloodstream. Okay, that's really about the extent of it. So, all right, so LOR, heart rate, respiratory rate, skin signs is a corollary or a rough gauge of blood pressure, are your vital signs we're talking about here. So again, that's the last piece to the puzzle of a secondary assessment. All right. Again, thanks for watching. My name is Rich Kutchman with Strategic Self-Reliance and Defense. I hope to see you in class.